Understanding the relationship between diabetes and insulin has always been complex. We are going to simplify it with the concept of Dr. R. Shivaa using a bus stop. We have a bus stop. There are people waiting to board the bus to reach their respective offices in different locations. The offices are the brain, the liver, and the muscle, along with other organs of the body. The bus stop is called the blood. The people waiting at the bus stop are the sugar. Hence, the sugar is waiting in the blood to reach the different organs for them to function efficiently. Let's look at a scenario. What happens when you're on prolonged fasting? You start to feel tired and giddy. That is because the sugar in the food has not reached the brain. Once you eat, the sugar reaches the brain and the giddiness and tiredness goes away. As much as the sugar is important for the brain to function, it is also important for all the organs of the body to function as well. Now for the people, that is the sugar, to reach the office they need a vehicle, which is the bus. This bus is called the insulin. The bus called insulin comes to the bus stop called blood, picks up the people called sugar and drops them in their offices that are the different organs. If the bus does not come to the bus stop, the crowd is going to increase. That is, without the insulin, blood sugar increases. This is what happens in diabetes. When the insulin called bus comes to the bus stop called blood, the people called the blood sugar are transported to various parts of the body and the blood sugar level is maintained. Where do the buses come from? The buses come from the bus depot, which is the beta cells of the pancreas. Hence, the buses called the insulin are a hormone which are secreted by the beta cells of the pancreas. When we lose 80% of the beta cells, the insulin secretion reduces and we develop diabetes. The other important character is the bus driver, which is the self-monitoring of blood glucose using a glucometer. This is essential for every diabetic individual to help them regulate their insulin medicine intake. It helps in keeping their blood sugar under control and avoid low blood sugar levels. The aim of every diabetic individual is to control his or her blood sugar to prevent complications and preserve their leftover viable beta cells. This ultimately helps diabetic individuals to live life unlimited and happily.